I really wasn't nervous. I mean, the last thing I would ever think about is having a heart problem.
We were in Texas and had been there for about a day and a half when we got a phone call in the morning on a Friday.
It was my cell phone and a number I didn't recognize. And you know, the first thing on the line is this is Dr. Harlemer from the Echoes for Athletes program. And it was crazy. I just really was not expecting that type of phone call about Nate.
His initial echo demonstrated that the area of his heart called the apex and his septum did not contract with enough strength.
At the time I was looking out the window and Nate was floating in the pool, and he's like, we don't want him doing anything strenuous at this time. We want him to kind of shut him down. Let's take a look, let's get him evaluated.
The interesting thing about the further evaluation was that that was the same week that basketball tryouts were being held, so time was kind of the essence.
We believe these events are caused sometimes by viruses. He would be a type of cardiomyopathy that improved with time, and he was able to be released and go right back to play.
Felt a little more lucky to be healthy like I am.
The Echoes for Athletes program is designed for student athletes, anywhere from the ages of 12 to 18. We already know that other events like broken bones and the risk of concussion can happen. What we haven't appreciated, though, is the risk of sudden cardiac death can also happen in athletes. This problem has been tracked nationwide, and it does appear that we lose a student athlete maybe as often as once per month in this country.
Well, I think the Echoes for Athletes program through IU Health is a great program, and I would recommend any young athlete or really any person to go ahead and go through it.
And it's better to know than to collapse on a court or something happen to you.
If you can put your mind at ease and know that your kid is in good health when they're out on a court or on the field or whatever, it is so worth it as a parent.